Well, there's a message being given at the moment to drink less, perhaps not what some people are expecting at the end of a year, particularly, well, if you follow politics too much. But that's the official warning. It's all to do with our health, the maximum drinks that you should be having per week from 14 down to 10. Joining me now to tell me why that is the case, Professor Anne Kelso, CEO of National Health and Medical Research Council. Thanks for your time today.
It's a pleasure.
So 14 down to 10, what's this based on? What would 14 do to you versus 10 drinks over the week?
Well, over the last 10 years since we recommended 2 per day, 14 per week, a lot more information has become available about the risks, particularly of cancer, from quite low levels of alcohol consumption. So based on a huge set of data and some modelling and expert consideration, NHMRC is recommending a decline in the number of average standard drinks that people drink per week.
And the 14 down to 10, I mean, can you talk to us about what the differences risk is? Is it that one might take 5 years off your life and one might take 2 in an average basis? Can you put a sort of quantify it?
It's hard for me to put a number directly on that, but the target in these guidelines is to have your lifetime risk of dying from an alcohol-related disease be 1 in 100. Right. So clearly a greater number of drinks per week increases that risk. I can't tell you exactly by how much, but the modelling and the advice that our expert committee has developed is based on that 1% risk as a target.
That's what you continue to strive for?
Yes.
So someone out there that likes a drink, to be frank about it, might say 1 in 100 is very low. What would 10 in 100 be? Can you give me some more guidelines? Because they might say, I'm just not going to cut it down to 10, but can you tell me the next range? Maybe I can keep to the next range.
Well, again, I can't give an exact number of drinks and percentage of risk, but what we do know is that even a small number of glasses every day increases, for example, the risk of a woman getting breast cancer. So that's the sort of thing that I think many people worry about. If by something relatively simple, a slight reduction in the number of standard drinks that people have per day, they can significantly reduce their risk of something like breast cancer or liver cancer or bowel cancer, then that may be of interest to many people.
Do you think, given Australians, plenty of them, and their desire for a tipple, though, there'd be value in sort of getting the next... This is obviously to be the very low risk group, and that's great, but if you get another group that maybe people above that can strive for the next group down, I mean, I guess that this might almost seem unrealistic to people.
Well, I think we need to take into account that there are about 4,000 alcohol-related deaths every year in Australia, so we're talking about a very substantial problem. And if we could reduce that number significantly by bringing most people down to a lower limit, then that would be fantastic from a human point of view and a societal point of view. So the point about this is that this is advice. We're not telling anybody what they have to do. We're giving them the advice that I think many people would like to have about how to improve their health through lifestyle changes.
I'm interested in what it had to say about breastfeeding, that breastfeeding mothers should not drink at all. I've got to admit, I've been reading a few studies about this in self-interest. I haven't seen any concrete evidence specifically about drinking, even moderate drinking, and effect on the baby. Are there studies you're pointing to? Is it just a zero risk sort of policy?
Well, the first thing is that whatever a woman drinks, the concentration of alcohol in her blood will also be in her breast milk. And then it'll take, just as it does in our blood, it'll take a while for that to wear away. So a woman who's breastfeeding might choose not to breastfeed for some hours after having some alcohol in order to minimise the amount of alcohol going into their baby. But that will be one thing to do. But of course, the best way to avoid the risk altogether is not to drink. Now, so the risks for the baby are the development of the brain. So the human brain continues to develop. Of course, it starts during development in the womb, but it actually continues to develop all the way through into early adult life, so even to the age of 25.
But it's that link. So again, studies showing a concrete link between brain development. Because when you talk about passing on, so I'm trying to use an average example. Let's say a mother's 0.05, had a couple of drinks. A baby has 100 ml of breast milk. That's the equivalent of having 1.5 millilitres of beer, and the baby's body weight of alcohol 0.001%. The point being, some of the studies you read suggest it's so small that doesn't actually have an impact on a
Well, I'm not an alcohol expert, so I'm not able to go into that depth of analysis myself. I'm not on the expert working committee, but the expert working committee is made up of people who do have exactly that sort of expertise to understand what the doses would be for the baby, and also to analyse the evidence that's been produced around the world. And so the last 10 years since the last guidelines have accumulated a lot more evidence on every aspect of the effects of alcohol on human development, as well as on the risk of immediate harm. So it's that advice that's been pulled together by the expert working committee to make these guidelines.
Because you also get mothers who have come from 9 months where, again, the guidelines say don't drink while you're pregnant, and I think most people either have a tiny bit or nothing at all, and then it's a stressful moment. I'm just wondering if it's more stress than being so worried about having a glass of wine or two a week versus saying, look, drinking in extreme moderation, you'll be okay, whether this message might make people a bit unnecessarily nervous.
Well, I think this is for the individual to decide whether they follow the guidance or not. It's not compulsory, it's not a law. It's the best advice that we can provide based on the evidence. That's our job, of course, as a health agency, to provide the best advice. So it's not for us to make social recommendations about how people use that advice, but it is for us to attempt to analyse data from all over the world and to give the best advice we can.
So are there studies posted on the website showing various things and links and...
What you can find on the website is all of the background information that's gone into these guidelines. So that's a document that, as a hard copy, would be about 50 pages. It's presented in an app form on the website, so there are easy ways to go to the data. So people can find all of the references and the studies there if they want to go into that sort of detail. All
right, well, summer reading, I'll have a deep dive. Can I ask finally, as you're giving, and I understand it's not, you have to follow this advice, but when you're giving this out to people, do you always get a positive reaction? Do you get other reactions?
I think that people understand what our role is. Our role is there to provide the evidence and to give advice, but not to force anybody to do anything. And I think everybody can make their own decision if they have the information that they need. That's our purpose.
Professor Anne Kelso, appreciate your time today.
Thank you very much.